DOLA patient-ready orthotics. The orthotics podiatrists use. A collection of our 9 most popular and proven prescriptions developed from over 50 years of clinical and orthotic experience. Patient-specific styles, ready to fit in clinic, orthotics for health professionals only. The sensitive patient-ready orthotic is designed for patients with complex medical history and advanced risk factors. This video will help you identify which of your patients will benefit from adding the sensitive orthotic to their treatment plan. What type of foot will it help? What does it look like and how does it function? What conditions will it help? And why will this patient-ready orthotic help your patients? Your patient may present with many pathologies of the foot and lower limb related to their complex medical history, risk factors, and tissue stress. Common medical conditions affecting the feet include diabetes, osteoarthritis, rheumatoid arthritis, neuropathy, or fibromyalgia. Common risk factors include poor footwear, a low tissue capacity, previous injury, or age-related changes. Tissue stress demands are applied from daily activities, sport and exercise, or your occupation. Pathologies seen in the sensitive foot can include metatarsalgia or general forefoot pain, neuroma, metatarsal capsulitis, bursitis, or neuritis, all relating to the impaired forefoot function in loading, but especially during propulsion or toe-off. Midfoot pathologies are also common, including plantar fascia or medial arch strain, and midtarsal joint or Lisfranc injuries, or midfoot osteoarthritis. Your patient may present with rearfoot pathologies, including plantar fasciitis or plantar heel pain, or fat pad syndrome. Lower limb and ankle pathologies are also common, including Achilles tendinopathies, gastroc or soleus pathologies, or lateral ankle instability relating to sagittal plane and instability or poor balance. Pathologies of the leg, knee, hip, and back are also common, affecting the knee joint, sacroiliac joint, and lower back, again due to global changes in gait pattern. The sensitive foot with an underlying medical condition, increase in tissue stress, and advanced risk factors can be seen in many different foot types, gait patterns, and pathomechanical function, including the supinated or pes cavus foot, the pronated or flat foot, feet with sagittal plane blocks, and even the relatively normal or neutral foot. Using plantar pressure analysis, the foot may present with high focal pressures relating to the forefoot function, often at the first metatarsal, second metatarsal, metatarsals 2 to 4, or the medial or distal hallux, indicating high forefoot loading. With many of the underlying medical conditions, high pressures are a risk factor for pathology and tissue breakdown. This may be initially seen as callus or hyperkeratosis. Vital management of the at-risk foot includes management of plantar pressures to avoid complications. The patient may also present with poor balance or an increased falls risk, again due to the underlying medical conditions and peripheral neuropathy. Increasing the plantar surface contact with the ground is a successful intervention for these patients. Sagittal plane issues of the ankle are also common, including a reduced ankle range of motion or ankle equinus due to a tightening of the posterior structures. This can lead to poor shock absorption and subtalar joint, mid-tarsal joint, knee, or hip compensations. This can be linked to the conditions including fibromyalgia, neuropathy, or an apropulsive gait pattern. Sagittal plane issues at the forefoot are common, including impaired windlass mechanism, low gear toe-off, and forefoot instability. This can again cause global gait changes, including a steppage gait or an unsteady gait. Mistimed gait events or global changes in gait pattern may also contribute to pathomechanics, including a steppage gait, apropulsive gait, unsteady gait, shuffling gait, abducted gait, adducted gait, all with matching changes to the heel strike, mid-stance, toe-off and swing movement patterns. The signs may already be there in your current treatments, giving you the confidence that the sensitive orthotic will help your patients. Have you had success with general foot taping, a footwear change to a more cushioned or supportive style, stretching or strengthening programs, improved capacity of the pathological tissue, or treatment-directed testing of padding or cushioning? Or has your patient had previous insoles? All of these may indicate that the patient-ready sensitive orthotic will be a successful option. So how does the patient-ready sensitive orthotic help my patient? This orthotic is specifically designed for patients with complex medical history and advanced risk factors to address the most common pathomechanical issues. Stable rear foot control. The rear foot platform provides stability for the transition from heel strike to mid-stance, helping with balance and the forward COP progression. The medial arch support provides support for the medial arch for transition from mid-stance into propulsion, improves the windlass activation, forefoot stability, and promotes a high gear toe-off, and increases the plantar contact area for plantar pressure distribution and balance. Lateral arch support. This stabilizes the foot and aids in transition from heel strike to toe-off. A mild heel raise improves sagittal plane transition from mid-stance to propulsion and addresses any ankle equinus. The full-length performance EVA shell provides the combination of cushioning and control needed by this foot. And the highly cushioned top cover with anti-shear technology reduces plantar tissue stress and reduces the risk in the at-risk foot. For more options to fix the feet that walk into your clinic every day, see the full patient-ready range and be sure to check out the rest of the training modules. Need help finding the right orthotic for your patient? Use our online Orthotic Selector tool. Tell us about your patient, their activity level, pathology or lifestyle and performance goals, their foot type, clinical test results, and we will recommend the best patient-ready orthotic from our range. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit DOLAorthotics.com.